Welcome, everybody. Well, thank you for spending the next hour with me as we discuss environmental surfaces in the dental practice, to review guidelines, best practices, and to provide you with a peace of mind. My name is Dr. Marie Fluent, and I am your host for this evening. And thank you to Viva Learning for providing moderation, especially Trung behind the scenes who is making this happening, and to Sycan Colteen as well for their sponsorship for this event. My email address and website is listed on the front page of this slide. So if you have any questions after today's presentation, I'm happy to stay online and address as many as I can. And if not, please feel free to reach out to me at a later time. Like I said, Sycan Colteen is sponsoring this webinar, so thank you for your sponsorship. As mentioned, I'm a general dentist. I'm certified in dental infection prevention and control, and I'm a consultant, author, speaker. And I know on this call tonight, we have a lot of dental team members who are very busy and busy with other infection control considerations or running your practice or all of the above. We have a good combination of dentists, hygienists, dental assistants, and front desk personnel on this call tonight. So thank you all for being here. You all have a role with regard to infection prevention and keeping track of our environmental surfaces. Our course description is very simple. We're going to talk about environmental surfaces, how they can become contaminated through touch, splash, or droplets during any type of dental care. And these surfaces are reservoirs for any type of contamination and can potentially transfer diseases to other instruments, other people, other surfaces, and other people, I mean both patients and team members. So we're going to talk about infection prevention and environmental surfaces specifically, your product selection, and what to look for in the label of your product. We're going to talk about different types of surfaces in the dental setting, key CDC recommendations, the importance of surface cleaning prior to disinfection, and spoiler alert, it is very important. Then, of course, we're going to talk about product selection for use and which surfaces are to be cleaned and or disinfected, and pros and cons, of course, of each different type of disinfectant that is available. So what is an environmental surface? It is any surface or piece of equipment that does not contact patients directly. So your instruments, of course, are touching patients directly, and these instruments absolutely must be sterilized. But your environmental surfaces do not need to be sterilized. They need to be cleaned and or disinfected. These surfaces have the potential to become contaminated through touch, splash, sprays, droplets that are generated during patient care, and are reservoirs for microbial contamination. So before we begin, I ask you to sit back and look at your own dental clinic. Number one, and first and foremost, I hope that you have an infection control coordinator on site, somebody in charge of your entire infection control program. Now, keep in mind, even though you have somebody in charge, your entire team should be committed and responsible for implementing the program. Number two, when was your last education and training session on environmental surfaces? We'll talk about that, how frequently your training sessions should occur and what they should cover. Number three, do you have a written protocol for your environmental surfaces and where is it located? Number four, does you and your team member, do you follow the instructions for use on all products, equipment, and chemicals used in your dental facility, especially as it pertains to today's presentation, environmental surface disinfectants? Are your clinic operatories neat and clean and not cluttered? We want to remove the debris and clutter and knickknacks from your operatory, particularly your environmental surfaces. We want them to be easily cleaned and wiped down and disinfected. And if you've got picture frames and reminders and mementos from home, it's more difficult to do that. And finally, which products do you use for cleaning and disinfection of your environmental surfaces? So there are two main surfaces in the operatory. The first is a clinical contact surface, and the second is a housekeeping surface. Clinical contact surfaces provide a potential contamination from spray or spatter, as I already talked about, and direct contamination from your hands or your clinical personnel hands, instruments, gloves, devices, and your emphasis for cleaning and disinfection should be on these surfaces. Some examples may include your light handle of your dental unit, bracket trays, the dental unit controls, computer equipment, or maybe your x-ray control panel as well. Housekeeping surfaces are surfaces that do not come in contact with patients or devices, and they pose a limited risk for disease transmission. These surfaces should be cleaned on a regular basis, and these surfaces may include your floors, walls, sinks, your break area, your reception room, and other non-patient areas. So keep in mind which surfaces you're trying to clean and which ones need to be cleaned and or disinfected. And I'll get into the nitty-gritty of both of those on upcoming slides. So here's a typical dental operatory, and I want to show you various surfaces and share with you whether they are clinical contact surfaces versus housekeeping surfaces. The floor, of course, is a housekeeping surface. The bracket table, you are going to be touching it throughout the clinical procedure as well as team members. So that, of course, is a clinical contact surface. The dental chair is covered up by the patient, so typically it does not come in contact with sprays and splatters. But having said that, if you notice areas of contamination, blood or debris, then of course it does become a clinical contact surface. Your countertop, once again, you may be touching it with contaminated hands, or spray or splatter may fall into that area as well. Drawer handles as well, if you touch them and contaminate them, they are clinical contact surfaces, and your light handle switch as well. This slide shows how long various microorganisms can live on a surface. And to me, this is an interesting slide because some of them can live on surfaces for quite a long period of time. MRSA, for instance, can live on a surface up to 7 months. Hepatitis A, herpes rotavirus, over 2.5 months, hepatitis C, 1.5 months, hepatitis B up to a week, influenza, a couple of days, SARS-CoV-2, which is the virus that causes COVID-19, can live on plastic and stainless steel for up to 3 days. So keep this in mind as you're cleaning your operatories and disinfecting them, that a good old-fashioned cleaning and disinfection is important because these microorganisms can live on for a long, long period of time. Now, here's another interesting morsel of information for you. And if you were alive in front of me, we would take a poll. Which do you think is the most contaminated surface? Your pet food container, a contaminated doorknob, your cell phone, a kitchen sink in the surrounding area, a toilet or a toilet seat, and the final image is that of a checkout counter in a grocery store where lots of people are touching it on a day-to-day basis. Now, the study that I'm about to show you does not come to us from the medical or dental industry. Instead, it comes to us from the food industry. And this is the result of that study. If you look at the chart on the left-hand side of the slide, you can see the number of bacteria per square inch of each of the surfaces that I listed on this previous slide. And what you will notice is that cell phones on the bottom portion of this slide have an exponentially larger amount of bacteria per square inch that are cultured than the previous, than all of the other surfaces combined. 25,000 bacteria per square inch can live on a cell phone, which is highly, highly contaminated. As you might anticipate, the food industry is very concerned with asepsis and cleaning the kitchen surfaces clean, just as we are concerned with asepsis and keeping our operatories clean and disinfected as well. So keep in mind, cell phones really should not be in the dental operatory. If they are in the dental operatory, please don't touch them. Don't leave them out on your countertop. If you inadvertently touch them, you need to stop, remove your gloves, wash your hands, re-glove up, and do not cross-contaminate any other surface in your operatory. And if you're in an educational setting, chances are cell phones are not allowed in the operatory anyway. So think of this slide, think of your policy, develop your policy, and make sure dental team members abide by this policy. Another consideration with cell phones is security and HIPAA violations as well. So we want to make sure that confidential patient information is not compromised with cell phones in the operatory. So your best practice is to not have the cell phone in the operatory in the first place. Now, the guidelines for environmental surface disinfection come to us from CDC guidelines. The principal document on the left is Guidelines for Infection Control in Dental Healthcare Settings. That was published in 2003. It's a little bit dated, it's a little bit difficult to read, and it's full of scientific jargon. So in 2016, CDC published a summary of the infection control practices in dental healthcare settings, basic expectations for safe care. This is the document on the far right. Now, keep in mind, a lot of our listeners tonight are from the United States of America, and some listeners are from other countries. But whichever country you come from and whichever state in the United States you are from, these guidelines are considered best practices and oftentimes gold standards. To my Canadian colleagues, sometimes you have nuances and little small discrepancies with regard to the guidelines and environmental surface disinfection. But in general, what I'm giving you, the information I'm providing you for you is are considered best practices in most countries of the world. So this slide comes to us from the CDC summary, and it provides key recommendations for environmental surface disinfection. Number one, you need policies and procedures for routine cleaning and disinfection in any dental health care setting. The second bullet point says that we should be using surface barriers to protect clinical contact surfaces, particularly those that are difficult to clean and sensitive equipment that might be damaged. These surfaces should be barrier protected between patients. 1B says that clinical contact surfaces that are not barrier protected should be cleaned with an EPA registered hospital disinfectant after each patient. And then an intermediate level surface disinfectant should be used if it is contaminated with blood. Now, I want to pause right there because my Canadian colleagues who are listening may have discrepancies between what type of disinfectant is used in your province. So be careful there, and if you have any questions, reach out to me. Bullet point number 2, select EPA registered disinfectant that with a label claim that's meant to be used in healthcare settings, and then finally follow your instructions for use. And that would go for any product, piece of equipment, chemical that you are using in any nation in this world as well. Always, always follow your instructions for use. So a couple of quick definitions. Number 1, cleaning is the removal of visible debris on a surface. And these surfaces can be contaminated with hands, like contaminated hands, or splashes or sprays. Disinfection is the process of decontaminating or killing most microorganisms, where sterilization is destroying all pathogens, including bacterial spores. And keep in mind, when we talk about environmental surfaces, we are not trying to sterilize, we're trying to disinfect. And then finally, our last definition is the contact time, and sometimes you will know this as a kill time. And this is the length of time that the disinfectant must remain wet on the surface to achieve disinfection, not sterilization, but disinfection. So keep these definitions in mind as we move forth. According to CDC guidelines, cleaning is the first and necessary step of any disinfection process. So if it's not cleaned, it can't be disinfected. So cleaning reduces or eliminates the reservoirs of pathogens and microorganisms on a surface, Any product that you use should have a good cleaning property and remain active in the presence of organic matter. In other words, if you've got lots of blood and bioburden on a surface and you are using a cleaning agent on that, it should remain wet and that product should be continued to be active while that organic material is present. And of course, you want to remove it and disinfect it, but this is just discussing the product to be used. Next, proper cleaning methods and mechanical action of cleaning alone will remove 99 to 99.9% of the microorganisms on a surface. That means good old-fashioned elbow grease is going to do a thorough job at cleaning, and do not underestimate the power of your cleaning. Here's some general cleaning recommendations. Cleaning always comes first before disinfection. Number 2, proper PPE should be worn, meaning heavy-duty utility gloves, masks, and protective eyewear. And the instructions for use on your label will tell you which PPE should be worn when utilizing this product. Follow the manufacturer's instructions for use for all steps and all phases of use of that product. And then don't use a liquid sterilant or a high-level surface disinfectant on environmental surfaces. And most of us aren't using these products anymore in our facilities. This would be in from years gone by considered cold sterile solution. Most of us aren't using that anymore, which is a good thing. If you are using a cold sterile solution or a high-level disinfectant, don't use it on your environmental surfaces. Much too toxic and can damage the surfaces, and there are a number of other reasons not to do that as well. So general housekeeping surfaces, those are surfaces that do not require the hospital level disinfectant. These should be cleaned on a regular basis with soap and water or EPA registered hospital detergent or disinfectant, and they should be disinfected if visibly contaminated with blood. Remember, I talked about the dental chair. The dental chair by itself is a housekeeping surface that should be just cleaned off with a regular household detergent. But if you notice visible signs of contamination with blood and bioburden, then clean and disinfect as if it were a clinical contact surface. Then you will have mops and cloths. Allow them to be used and dry thoroughly before reusing, or use single-use disposable options as well. And then, of course, you want to prepare fresh cleaning and disinfecting solutions daily and according to the manufacturer's instructions. Think of your household when you are washing dishes by hand. You prepare fresh dish detergent with every dish cleaning episode. There is no harm in emptying it, dumping it down the drain, and preparing a fresh solution, particularly if it has sat around for a while or you have visible debris in it. So the next part of our environmental surface program is having a written policy and protocol in place. Make sure that you have written policies and procedures available for anything you do with regard to environmental surfaces. Why? And the answer is because if you have a step-by-step set of instructions, it does improve consistency and efficiency, enhances compliance, and reduces miscommunication. The last thing you want to do is have a brand new team member, a new hire on your team, toss them an environmental surface disinfectant in its canister and say, could you please turn over this operatory? We need the next patient seated in 5 minutes. That new team member needs to know exactly how you want that operatory turned over, which surfaces should be cleaned, which should be disinfected, which should be barrier protected, how to use that chemical, what personal protective equipment to be worn, etc. So if it's not written down, there is room for human error to occur. Then you need a written cleaning schedule, and this should include where in the facility or what surfaces need to be cleaned, what surface should be cleaned, how frequently it should be cleaned, what type of soil do you anticipate being present, tasks or procedures to be performed, the use of barriers, and surfaces must be appropriately disinfected after completion of any procedure with a splash or spray if it involves potentially infectious materials. So next slide, this slide talks about training. When should training occur? According to CDC, training on environmental surfaces should occur when the new hire is on the team upon hire. When anytime your policies or procedures change, or say you have a new type of product that you're incorporating into your daily protocol, you need to update training to make sure everybody knows how to use it, and of course, at least annually. And this information comes to us from CDC, and it is consistent with other countries and OSHA as well. Now, appropriate personal protective equipment should be worn to prevent any exposure to infectious materials or chemicals. Let's face it, some of the chemicals that we use in dentistry are pretty harsh, and we need to make sure that we're protected against them. So PPE may include a combination of gloves, gown, masks, and eye protection. And in the case of the United States, we ask that dental personnel wear heavy-duty utility gloves, and your canister instructions for use will specify that as well. The correct type of PPE depends on the chemical that you're using and the anticipated type of exposure as well. So do not underestimate the power of PPE and the protection it can provide. Now, when you select a product for your practice, what you're going to look for in the United States is your EPA registration number. In Canada, you're looking for Health Canada products. Make sure that whatever product that you're using is indeed a hospital disinfectant. It's compatible with the surfaces you intend to clean and disinfect. You want to make sure that your product is a good cleaner as well as a disinfectant. The potential for allergies is low. You have low toxicity, a product that's easy to use. You want clear instructions. You want a reasonable contact time. And I share that because some of the products from years gone by had, like, I saw the longest contact time or kill time was 10 minutes. And I know when turning over an operatory and seating your next patients, you don't have 10 minutes to kill, literally and figuratively. So that is not a reasonable contact time. Nowadays, most contact times I see are 3 minutes or under. So look for something that's doable in your operatories. Then you want a product that is easily stored and disposed of as well. This slide shows a pyramid on types of microorganisms, those that are the most difficult to kill at the very top of this triangle, and microorganisms that are easier to kill at the bottom portion of this. And of course, the middle portion contains microorganisms that are a little bit more difficult to kill, but not quite as difficult as bacterial spores. So the only products that will kill bacterial spores are high-level disinfectants, but remember, we're never going to use these on environmental surfaces. Those that are at the intermediate level include mycobacteria, non-enveloped viruses, poliovirus, rhinovirus, norovirus, fungi, candida, and those that are easier to clean include staph, Pseudomonas, Salmonella, enveloped type sized or medium-sized viruses, HIV, influenza. And keep in mind, hepatitis B and C are very easily killed, as well as coronavirus and herpes simplex virus as well. So in the United States, we're looking for a product that is intermediate level that can kill microorganisms in the center of this pyramid or triangle. Some countries require a low level of disinfectant, so check with your country's guidelines before you quote me. But in the United States, we absolutely need to be using an intermediate level surface disinfectant that can kill the microorganisms in the center portion of this pyramid. Now, when we clean and disinfect environmental surfaces, if there's no blood, then if it's a clinical contact surface, you're going to use a hospital disinfectant with a tuberculocidal activity. And if it's a housekeeping surface, Plain old detergent, soap and water would do the trick, or a hospital disinfectant is fine as well. But as soon as you see blood and have potentially infectious material, then whatever scenario you are faced with in the United States, you should be using a hospital disinfectant with a tuberculocidal activity, and that is an intermediate level surface disinfectant, as we just described on the previous slide. Now, the next slide, this slide, talks about the instructions for use. The IFU will tell you how to dilute the product, store the product, what is the shelf life, what is the contact time, and what personal protective equipment should you be using. In addition, some of the products on the market now are a one-step product and some are still a two-step product, and we'll talk about what that means in upcoming slides. If the product is a good cleaner, we want a product that is good at cleaning as well as disinfection, and of course the contact time. And I kind of covered the rest of these items as well: hazard identification, PPE, storage, disposal, and expiration date as well. Now, here are some common active ingredients in surface disinfectants. And you will notice that the ingredient on the left and the notes on the right, that not all common ingredients are compatible with all surfaces that we intend to disinfect. For instance, alcohol can be detrimental to certain materials and surfaces, and alcohol by itself is not really good at cleaning. If you're trying to clean and disinfect a number of plastic surfaces, you're going to notice discoloration or cracking or crazing of that surface as well. Phenols can be corrosive and not suitable in the food industry, and that's okay because we're not dealing with food. But they are also absorbed by rubber and plastic, and not very effective against spores and viruses. Hypochlorites are essentially what we know as bleach. Bleach is very corrosive and, as we know, can be damaging to metals and fabrics and has that infamous pungent smell as well. Hydrogen peroxide is an excellent oxidizer, and once again, it's not compatible with all surfaces, but hydrogen peroxide is the most environmentally friendly of all of the active ingredients listed on this slide. Hydrogen peroxide is H2O2, and it decomposes into water and oxygen. So there are no toxic chemicals involved with hydrogen peroxide. And finally on the list, we have quat ammonias. These provide a broader spectrum, and they have good cleaning products, but they're generally not tuberculocidal on their own. So generally they must be mixed with something. So there are pros and cons to all of the active ingredients, and make sure that your product is compatible with the surfaces you intend to clean and disinfect. And this slide shows a number of representative types of products that are available on the market today in the United States. Other countries have other examples as well. You can see that a lot of these products come in a spray or a wipe or a canister or whatever the case may be. So look, as you choose them, read the active ingredient and look for all of the things that we talked about on the previous slide. Now there's a new kid on the block, a new disinfectant named Optim OS1, and I'm going to delve into this. This new disinfectant combines chemistry of cleaning and disinfection through penetrating and killing of bacterial cell membranes of the bacteria, and it's made with a detergent. Detergents are known as a surfactant. A surfactant's job is to loosen up the debris on a surface so that it cleans off, rinses off, wipes off much easier. When you use soap and water at home or in the shower, the soaps that you use on your human body are surfactants. They loosen up any type of debris on your skin so it can simply be washed off in the shower. The same is true with your disinfectants and the detergent component. So this surfactant is widely used in a commercial cleaning application, and then there's a biocidal agent. So the older product or version is Optum One, and the newer kid on the block is OS One, and we're going to talk about the differences between them. Optum One on the right, the active ingredient is accelerated hydrogen peroxide. It's excellent at wetting, chelating, and surface acting agents. It kills tuberculosis in 1 minute. Accelerated hydrogen peroxide is excellent at removing organic debris while disinfecting, meaning an excellent cleaning agent. It's non-toxic, non-irritating, and lowest in the toxicity category. The item on the left is the OS1 that we're talking about today, and there's a unique chemical that is called the LAS active system, and that's a proprietary type of chemical that I'll get into on the next slide. There is a combination of a surfactant with the biocidal agent, once again a 1 minute kill time, and what this product does, this specialized proprietary chemical or molecule does, is it traps and removes debris, and I'll go over that on the next slide. It's fragrance-free, dye-free, no harsh fumes or residues, so a very gentle product to be used. Now, this is a Marie Fluent slide, not a Coltine SciCan slide. I thought of this slide when I read about this LAS system and how it works, and I got to thinking, this reminds me a lot of a Venus flytrap. A Venus flytrap is a plant that traps flies and other flying creatures into its little leaves, traps them, and what happens is the fly is attracted to the nectar inside the trap. When the fly touches the hair, there's this signal, and it causes the trap to shut. Then the plant secretes an enzyme to kill and digest the insect, and of course this is very effective and provides food and nutrients and survival for the plant. So I thought of this and I thought, boy, this is a lot like that LAS system. So keep this image in your mind while we advance to the next slide. So here we are on this LAS active system, and what happens here is that you've got a very large molecule with two ends. One end is water-loving, hydrophilic, and the other end is fat-loving or lipophilic end. And so what happens is you've got the surfactant molecule that has both portions, water-loving and fat-loving, and the portion that is attracted to and loves the water, and then the tail loves dirt, debris, and any type of pathogens. So when the molecule encounters any type of debris or microorganisms on the surface, the tails entrap the debris by forming what's called a micelle. And then once it's entrapped, then the LAS active system penetrates the bacterial cell membrane to actually kill the bacteria or the microorganisms that's trapped within. And it works very much like the Venus flytrap on the previous slide, which is kind of why I liked that analogy. So think of that analogy as you think through this molecule and how this LAS system works. So if you are using a two-step surface disinfectant, what you do is this. If you're using a disinfectant spray, you spray, wipe, spray, and then you wait. You wait for the duration of the contact time or to kill time, and that surface must remain wet for that full duration period of time. And then you can go ahead and set up your operatory for the next patient. If you're using a wipe product, the same sequence of events occurs, but using a wipe instead of the spray. So the sequence would read wipe, discard, choose a new wipe, and then wait for the duration of that contact time as well. Now, sometimes we're using a product that is one step, meaning you clean and disinfect in one swoop. And if you're using a spray, then your sequence is spray, wipe, wait. And if you're using a pre-moistened towelette, then wipe, discard, wait, and you're waiting for the duration of the contact time or kill time. However, if you're using a one-step product and your surface is heavily soiled or has visible debris or bioburden on it, your instructions for use may say pre-clean heavily soiled areas. In that scenario, you would go back to the previous slide and make it a two-step product. You would spray, wipe, spray, wait, or wipe, discard, wipe, wait, as if you were using a two-step product. So those of you who are listening, if you are in a periodontal practice or you're a dental hygienist scaling and root planing, or if you're in oral surgery and you have lots of blood and bioburden, consider your product a two-step where you clean, disinfect in two separate phases. So if the instructions for use on the Optima OS wipes, let's review what they say. Number one, you're going to pull that towelette out of the canister at a 45-degree angle, not straight up, not straight off to the side, because you don't want to wipe off all of the disinfectant juice, if you will, that is clung onto that towelette. You want to pull it out and have that as saturated as possible. And notice the next morsel of instructions: close the lid. One of my pet peeves in dentistry is walking through operatories and seeing these open canister in each and every operatory. When that happens, the active ingredient in the disinfectant can evaporate, and that makes your product less effective. So always close the lid after use. And if the surface is not heavily soiled, then you can clean and disinfect for the contact time. And if it is visibly soiled, use a second towelette to disinfect. And we already reviewed that on the previous slide, so you know what I'm talking about there. Then the IFU goes on to say, for best results, do not over-apply the Optima OS 1. And if you use this on brass, copper, and clear acrylic, there could be discoloration or damage if you do not use the product as directed. In other words, don't let this product pool up and sit longer than the duration of the contact time. And then, of course, wear appropriate personal protective equipment. And if you're using Optima OS 1 for disinfection of impressions, what you would do is this. Number one, always rinse your impression under running water to remove blood and saliva and bioburden. Number two, you're going to shake the impression to get rid of the excess water, and you're going to do this in your sink so you're not splashing and spraying throughout your office. Number three, you're going to spray the entire impression with Optima OS 1 and follow the contact time that I just mentioned. And then fourth, you're going to remove excess disinfectant and shake gently to remove the excess water, once again within your sink. Once it's dry, you're going to place your impression within a sealed bag and communicate your disinfection method with your lab technician. You always want to do that so that you are not duplicating the disinfection process, and so everybody has a clear understanding which laboratory products have or have not been disinfected. Now, if you are using one chemical and switch to another, or you're switching to Optima OS 1, here are some instructions for you. Number one, make sure that you give all of your surfaces a good old-fashioned cleaning with soap and water before switching. And the purpose of that is you want to remove residual chemicals from the previous disinfectant that was used. If you do not, number one, you're going to notice maybe discoloration or clouding of your surfaces, and number two, you might notice a smell that is not so appealing as well. So you'll always want to remove residual chemicals. Once you do switch to Optima OS 1, then periodically all surfaces should be rinsed with water, and it's recommended to do this at least once per week. And once again, you want to remove the residual chemicals to protect your surfaces. Next, it's a good idea to rinse and dry surfaces to maintain surface integrity with any chemical that you might be using. And then finally, we know never to mix chemistries of various products. So in other words, if you're using Optima OS 1, use that exclusively. If you're using a different product, use that product exclusively, and don't mix these chemicals together. bad reactions can occur, and of course, it could be dangerous. There are pros and cons between wipes, sprays, and barrier usage. So the pros of wipes are you have less chemicals and sprays in the environment, maybe more equipment friendly. And between sprays and wipes, you're not adding plastic to the environment and it doesn't change the appearance of your operatory. Surface sprays may be less expensive than wipes or barriers, but we're going to talk about the cons of that on the next slide. With regard to barriers, yeah, they are time saving. You don't need a safety data sheet. There are eco-friendly choices that are more readily available, and there is no equipment and chemistry compatibility issues at all. Now, the cons of all of these include, with regard to surface wipes, there's potential for misuse, and you may need more wipes for a larger surface area. And they can be more expensive than liquids. The surface sprays, you must dispose of residual chemicals in accordance with environmental laws, and there's more healthcare worker toxicity reactions because there's a misunderstanding that surface sprays can be used in the air as well as surfaces. But keep in mind, if you use a surface spray, this is not an air freshener. It needs to be used on the surface you intend to disinfect. Then there are chemical and equipment compatibility issues, and safety data sheets are required as well. Now, barriers, the downsides are, number one, you're adding plastic to the environment. You've got a change in physical appearance of the operatory. Sometimes you require disinfection of that surface in addition to the barrier. And you need barriers in various sizes and types of colors. And of course, this does add an additional cost over chemical sprays and wipes as well. So there's pros and cons, and most dental facilities use a combination of all of the above. So talk to your dental team members and see which surfaces you would like to clean and disinfect using which method, and fabricate a policy within your own particular practice. Now, one day, once upon a time, I came into my dental office and my dental assistant said, Dr. Fluent, we are out of surface disinfectant wipes, but do not worry, I made my own. And I said, how'd you do that? And she said, well, I took this old container, I filled it up with 4x4 gauze and put in a surface disinfectant solution on top of that, and I essentially made my own wipe. And what do you think about that? I think about that is that it's not a good idea. It's very important to follow the manufacturer's instructions for use, and the chemicals in which the gauze have been fabricated may not be compatible or may cause some type of chemical interaction with the disinfectant to be used. We don't know if the active ingredient is still active. We don't know if there's chemistry incompatibility. There's so many unknowns, and the manufacturer cannot guarantee this product is safe and or effective. So don't make your own wipes. Don't deviate from the instructions for use. Now, when I was consulting at an office last summer, I went into an operatory and I saw this little trifold sign that said, this operatory is clean and disinfected and ready for use. And I thought, that is a really cool idea. If I were a patient and sat in that chair, it would give me confidence and peace of mind that this operatory had been prepared exclusively for me and that somebody was attentive to all of the details in operatory preparation. Is this required? Absolutely not. But hey, what a great idea. So consider adopting this. We talked a little bit about surface barriers, but let's go into that a little bit deeper. Barriers protect surfaces from becoming contaminated. They are impervious to moisture. They may be pre-cut and fitted to the surfaces that you intend to cover, and it's best to use barriers that are intended and fabricated for that purpose. They can be provided for hoses, light handles, headrests, and more. There are tear-off films that can be used to protect larger surfaces as well. When do barriers require being changed? They need to be changed between each and every patient. When do they require changing and cleaning and disinfection? In other words, in addition to the barrier? Well, in Canada, all the time. But in the United States, at the beginning of the day, end of the day, and when the barrier is compromised. And if that is the case, if you notice the barrier is compromised or you have bioburden or contamination, yes, you need to clean, disinfect, and then apply a clean barrier with a clean set of hands. Now, in Canada, my Canadian colleagues, you're cleaning and disinfecting all barriered surfaces, each and every patient, each and every day. Now, this is an image from my previous office, and these are the surfaces that we would barrier protect. And you will see the light handle switch, the control panel to the X-ray, the control panel to the dental unit, sensitive computer equipment, including the keyboard, the mouse, and the well, any type of sensitive equipment associated with the computer as well. So here are some clinical tips. Barrier covers must cover the entire surface. Wear gloves to remove and discard the contaminated barrier. Use clean hands to place the clean barrier for the next patient. Barriers must be fluid proof, and it is best to utilize commercial barriers. And now they are making prefabricated barrier products for your sensitive equipment. I like this keyboard cover. You can simply clean it down, wipe it down with an environmental surface disinfectant wipe or a spray product, and without the fear of it causing damage to the sensitive keyboard or chemicals, residual chemicals or bioburden remaining. So here are some take-home points for you from my presentation. Number one, there are many different types of subsurface disinfectant products available. Make sure you evaluate the product of your surface cleaners and disinfectants before purchase. Always select products that are good at cleaning as well as disinfection. Always follow the IFU. Make sure the product is compatible that you're surface disinfecting. Second, use surface barriers for difficult to clean areas or areas that can become damaged with the use of cleaning and disinfectant agents. Surface cleaning is very important. It's at least as important as disinfection, and that's when we talked about good old-fashioned elbow grease of cleaning the environmental surface before disinfection. Next bullet point says surface wipes reduce aerosolized chemicals. And if you have a team member who is really overzealous with the spray products, it can become problematic and cause health concerns for dental team members. So surface wipes will eliminate aerosolized chemicals. And then finally, we already mentioned this, but never use a sterilant or a high-level surface disinfectant on environmental surfaces. I have lots of resources available for you. And these are primarily Centers for Disease Control and Prevention. And then I've got an EPA resource for you as well. And if you are in other countries, look for your regulatory agencies as well. So now what I'm going to do is open up the floor for Q&A. I'm going to go to the Q&A box, and I see that 2 questions have arisen. Okay. The one question says, where should heavy-duty utility gloves used for cleaning disinfection, where should they be stored? And most offices have little clips on them, and I kind of equivocate them to around the holiday time, if you have stockings hung by the chimney with care, there's no harm in having utility gloves hung in the sterilization room with care. It's important to make sure that each team member who uses heavy-duty utility gloves has their their own pair. I would take an indelible marker and mark them with the team members' initials. I would get a clip that you would use in household use and make sure they hang up in the cleaning and disinfection area where they cannot cross-contaminate any clean or sterile instruments. And make sure that, like I mentioned, every team member had a pair. The next question is, why didn't I have a barrier cover on the mouse and the keyboard picture? And I think I did. And if I didn't, I should have. Are typically the mouse in the operatory that's used for the computer equipment is covered with a barrier protection. And if you notice that I didn't, I'll go back and correct that question. Now I had a question from Beverly that talks about endophiles and pouching. And since this is up and beyond the scope of today's presentation, if you want to reach out to me via email, I'm happy to answer your question privately off the call. Next comment, great presentation. Thank you. The next question is there's a common brand. How does it compare to other brands? You have to read the product label, and obviously I am sponsored today by Optum One, and OS One and Optum products by Sycan Coltine. So that's the product that I really wanted to focus on today. But if you wanted to reach out to me on the side, I'm happy to have a discussion with you later. The next question is, do utility gloves need to be autoclaved at all? And the answer is most times heavy-duty utility gloves can be cleaned and disinfected as you would an environmental surface. And some utility gloves can be autoclaved, which is very, very cool. But having said that, there is a shelf life. They don't last forever. If you notice your utility gloves are becoming cracked, crazed, or damaged, then throw them away and get a new pair. They are not that expensive. The next one, I'm reading through my questions, so bear with me. Was from Paige. We have wipes and sprays. We typically spray and then use the wipes. I know it was mentioned that the sprays can be a health issue for healthcare providers. Would it be okay to just use the spray? Absolutely, yes. You are overkilling, Paige. You are doing purchasing twice the chemicals that you need to and disinfecting twice. So either spray or wipe, but you don't really need to use both. I kept both in my office because some surfaces we wanted to spray, and of course our impressions we would spray, and for our surfaces we used wipes. So Paige, it's either spray or wipe. You don't need to do both. And let's see. The last question was, what about Optum wipes compared to Optum OS One? I showed one slide that compared the differences between them, and I believe that Viva Learning will make this presentation available to all attendees. So I urge you to go back and look at that particular slide and make sure that you understand the differences between them. Next question, do I need to keep a log of when performing environmental surface cleaning for the operatories? And if so, how long do you need to keep it? You don't need a log, but of course all operatories do need to be cleaned in between patient use, of course. And that's why I liked that little sign that said this operatory is clean and ready for patient care. But you are not required to keep a log. Now, sometimes if you notice a team member is not up to speed or really is new on the team and doesn't understand the policies and the protocol, you might have to go back to logging, but that would be for your own internal use. Nothing that's required, nothing that needs to be reported, nothing that needs to be maintained. It would be for your own purposes to help you keep track of what's done, when, and by whom. So keep that in mind as well. The next question is, can you use a disinfectant on your face when you get a splash from patient coughing? Please don't ever do that. No, 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 that's a bad idea. The products that are used for disinfection of surfaces are registered by the EPA, the Environmental Protection Agency, whereas those products that are used on the human body are FDA, Food and Drug Administration approved. So what's used on a surface is probably much too harsh to be used on your human skin. And I've seen people do that. One particular case, I noticed a team member wiping their nose constantly because they did not want to get a cold. Their family member had a cold, and they were using the environmental surface disinfectant on their face. Well, their face broke out in this horrific rash. And finally, we came to the conclusion of what they were doing. And I said, you've got to stop exposing your skin to those harsh chemicals. Clean with just gentle soap and water. Don't do that again. And let's see if that heals up. And if it doesn't, you might need medical care. So never, never use environmental surface disinfectant products on your human body. Then there is a comment saying the only products you can use on your face or body is hydrogen peroxide. But once again, if that hydrogen peroxide is intended to be used on environmental surfaces, never use it on your face and body. It's probably safe to do, but don't do that. That is an environmental surface disinfectant and it's not meant to be used on skin. Utility gloves, store them in the sterilization area in an area that is not intended to be cleaned, or store sterile instruments. I don't want cross-contamination to occur. And my final comment was this was a very fluent presentation. Thank you for the pun. I appreciate that. At one time, I did name my program Letting Your Program Run Fluently. Oh, wait. Another final comment. Wait, I thought hydrogen peroxide was safe for cuts and scrapes. Well, if you purchase hydrogen peroxide from a grocery store or a pharmacy and it's intended for that purpose, great, have at it. But if you purchase a hydrogen peroxide based product that is intended for environmental surfaces, do not use it on your human body. Probably it will be okay, but there are other chemicals and active ingredients in there that might not be compatible with your human body. So only use products on your body that are intended to be used in that fashion, and only use environmental surface disinfectant products on your surfaces. Here's another question that's important to address before I get off the call today. Our office uses wipes for safety glasses, and it leaves white streaks. I wonder if that's fine. Let's talk about that real quickly. Depends on what safety glasses you're talking about. For my dentists and some hygienists who are wearing loupes, don't ever use a surface disinfectant on the lenses of those loupes. That's not intended to be used by the manufacturer. You can destroy the lenses themselves. You can destroy the protective coatings on the lens and the anti-fog, anti-scratch components of the lenses as well. So never, never use surface disinfectant on protective eyewear unless the manufacturer of the loupes or protective eyewear says it's okay. And if you're in doubt, call them up. Now, patient safety glasses are typically very inexpensive plastic, and if you want them to be used, the shelf life on these is not forever. So if they become discolored or cracked or crazed, throw them out and get a new pair. One more thing, my dad is an optometrist and we only use dish soap and water. And that may be okay for you, but once again, with your loupes, check with the manufacturer and check to see if they can be submerged or not submerged. I've seen loupe damage, and as you know, these loupes can be very expensive, a couple $1,000s. If you submerge them into a dishwashing solution, you may dislodge or disrupt the glue coating, the adhesive coating that layers the lenses together. So you need to be very, very careful and follow the instructions of the loupe manufacturer. And if your optometrist says it's okay on the glasses that you're using, great, have at it. But always, always listen to the manufacturer first over my recommendations. So with that, I will will conclude today's presentation. When you close this presentation, you will be led to a 5-question assessment, and I believe you need to fill that out to receive your continuing education credits for today. And you have my email address, and I thank you very, very much for spending the last hour with me, and I look forward to our paths crossing again. Thank you, and good evening.